Who are the healthiest people? Are they athletes, teachers, gym goers? What about medical staff? Surely those working in healthcare would be the healthiest, right? Welcome to the People of Public Health. My name is Ben, and I'm presenting on Dharawal land on the 4th of April 2022. Today, I'll be unpacking how employment and governance affects healthcare workers and how these determinants have been affected by the COVID-19 pandemic. I'll also be looking at some of the things we can do to better the health of our healthcare workers. What separates healthcare workers from other people is their job. Healthcare workers provide services for people who are sick, injured, or hurt. They work directly with patients, like doctors, nurses, and midwives, or indirectly, like admin staff, receptionists, or even cleaners. Employment refers to whether someone has a job, be it casual, part-time, or full-time. The Australian Institute of Health and Welfare tells us that employment is usually associated with higher income, healthy behaviours, and good mental health. And yet, healthcare workers are more likely to experience anxiety, depression, burnout, and suicide than the general population. To get a better understanding of what's going on, let's dig into some of the workplace influences of health identified by the World Health Organization, the physical work environment and the psychosocial work environment. The physical work environment for healthcare workers is extremely hazardous. Musculoskeletal problems from moving patients, sharps injuries from scalpels and needles, violent patients, and chemical burns are all common. But another major risk is contact with disease. During the COVID-19 pandemic, hospitals were flooded with patients infected with COVID. The WHO estimates nearly 180,000 healthcare workers died from COVID in the first year alone, with nearly 70% of these infections likely occurring in the workplace. On top of this, the psychosocial work environment in healthcare is problematic, with a negative stigma of mental health and low uptake of psychological support. During the pandemic, this environment got worse. Healthcare workers reported greater stress, anxiety related to infecting loved ones, greater working hours, and bulky PPE. Unfortunately, these factors, combined with ease of access, have increased the rates of substance abuse, traumatic stress disorders, and suicide among healthcare workers during the pandemic. So what can we do about it? Fortunately, the Healthy Workplace Framework by the WHO has the answers we need. In order to address the hazards in the physical environment, personal protective equipment, or PPE, is very good. Yet, during the pandemic, there was often shortages of PPE, with many healthcare workers reporting bad reactions to it. So while PPE is a great start, it needs to be more comfortable and cheaper in order to keep up with demand. The WHO framework also recommends stress management techniques to address psychosocial problems. One systematic review found that yoga is great at reducing job-related stress for healthcare workers. So, healthcare services might consider promoting yoga sessions to their staff. Now let's zoom out to the government level. Governance is a political determinant of health that refers to how organized a society is. In the conceptual framework for the determinants of health by the World Health Organization, governance affects healthcare workers directly through policies relating to healthcare, or indirectly by actioning proposals that reduce the strain on healthcare services. However, poor communication is a massive barrier to effective governmental organization, which can negatively influence healthcare worker stress and well-being. And this is exactly what happened during the pandemic. Before I go any further, I want to introduce the demand control model of workplace stress. This model says that employee stress is greatly exacerbated by two things. One, a stressful job, and two, that employees have a lack of control or uncertainty surrounding their work. During the pandemic, poor government communication acted as the fuel to the flames of the healthcare system. Federal and state policy was inconsistent, relied too heavily on hospital capacities, and the advice for medical staff was constantly changing. These problems affected healthcare workers like Liz, a medical receptionist who experienced the problems associated with government communication firsthand. So Liz, can you tell me about the communication between the government and yourself during the pandemic?
Yeah, sure, there was none. Plain and simple.
None.
We found out about all of the changes at exactly the same time as the general public.
Tell me how that affected the healthcare workers around you.
Yeah, definitely a lot of mental health problems increased. I think there was a lot more pressure on us, so that was a bit anxiety inducing, and a lot of people had to take time off because of it.
And it wasn't just Liz and her colleagues. Multiple studies found that healthcare workers' stress, depression, anxiety, PTSD, and suicide were greatly elevated during the pandemic. Using the demand control model, the best way to reduce healthcare worker stress is to improve government communication. A potential solution is e-governance, or using the internet to host public discussion about government action. Research has shown that e-governance effectively promotes open communication with the public and leads to more effective policy. However, the main problem with e-governance is that it inhibits the voices of those who are digitally excluded, which over a quarter of Australians were in 2021. As we can see, the problems in the physical and psychosocial aspects of healthcare work need to be addressed. These problems contribute significantly to healthcare morbidity and were exacerbated by the pandemic. Additionally, governments need to ensure effective and clear communication to healthcare workers, especially during times of stress on healthcare services. Thank you so much for listening. I'll see you next time.